always show my PowerPoint to my audience as I'm reading it, but I showed them my PowerPoint beforehand. Here's my notes. I don't have any note cards, but I used just not even a full page of stuff. There's little notes and stuff I wrote down. So I shouldn't be using them. And then as my audience, I have them on FaceTime. It's my brother, his girlfriend, and my girlfriend. They're all 18 or older, so they're all adults. I hope this goes good. Imagine doing the sport you love your whole life, and then one hard hit changes the way your brain works forever. Every year, millions of people suffer concussions, and athletes are the people that most at risk. As an athlete myself, the topic is important to me because injuries are always a possibility, and protecting your brain is just as important as protecting the rest of your body. Today I will talk about concussions. First, I will explain the history. Start that. First, I'll explain the history of concussions and how they affect the brain. Second, I will discuss current treatments and ways they work in concussions. And finally, I will talk about what the future may hold. May hold for concussion research. First, let's look at the history of concussions. Concussion is a type of traumatic brain injury that happens when a hit or bump or sudden movement causes the brain to move inside the skull. According to the Centers of Disease Controls, Disease Controls and Preventions, or is known as CDC, last accessed in 2026, a concussion can affect how the brain normally works and can cause problems with memory, balance, thinking, emotions. Years ago, concussions were not taken very seriously. Athletes were often told to shake it off, get back in the game. Doctors now know that repeated concussions can have a serious long-term effects of the brain, which has changed the way sports organizations, schools, or medical professionals handle these injuries. Now that we have looked at the history of concussions, let's examine the current treatments, preventions. There's currently no medicine that can instantly cure a concussion. The most important treatment is giving the brain time to heal. According to the CDC website, athletes should not return to their sport until they have been evaluated by a healthcare professional. Your symptoms until your system and holy crap. Athletes should not return to their sports until they have been evaluated by a healthcare professional and their symptoms have improved. Common symptoms include headache, dizziness, concussion, blurred vision, sensitivity to light, numbness, nausea. Recovery may take up to a few days. It can also take up to a few months, or I'd say probably a month, not a few months, but yeah, I guess it's a possibility. Prevention is also very important. Wearing the proper safety equipment, learning good technique, following the rules of the sport, and reporting symptoms honestly can all help lower the risk of a more serious injury. Athletic trainers and doctors now use concussion evaluations to decide when it is safe for someone to return to play now. Now that we understand today's treatments and preventions, let's look at the future of concussion research. Researchers continue to search for better ways to diagnose, treat the concussions according to the National Institute of Neurological Disorder and Stroke, last accessed in 2026. According to the National Institute, According to the National Institute of Neurological Disorder and Stroke, scientists are studying advanced brain scans and blood tests that may show doctors to detect concussions more quickly and accurately. Researchers, while there is no cure, today we looked at concussions in athletes. These new discoveries give doctors and athletes hope that concussions can be treated more effectively in the future. Alright. Today we looked at concussions in athletes. First, we learned about the history of concussions and how they affect the brain. Second, we discussed current treatments and ways to prevent these injuries. Finally, we explored the future of concussion research. I hope the speech shows why concussions should never be ignored. If you or someone you know experienced a concussion, take it seriously. Follow your doctor's advice and never rush back into your sport before the brain is fully healed. A game can always be played another day, but you only get one brain, so appreciate that.